As we continue to track the devastating impacts of the deadly assisted living facility fire in Fall River, I'm speaking with a mental health professional about the impacts these events can have on those involved. And Dr. Brandon Gaudiano, the program director of the Transitional Outpatient Program at Butler Hospital, is with me. Thanks so much for joining us today. We're talking about, a really tough subject today. And let's start off with the first responders. There was breaking through windows, people panicking, they're trying to get out. What's going through their minds then, and what does the fallout look like?
Well, that's very important because they're certainly, they're used to responding to these kind of things, but every kind of situation like this is always something that is not expected and does have an impact on first responders. And they are at increased risk for the negative impacts of traumatic events, even though they are trained to do that. So, I'm sure that this was a harrowing experience for them as well in terms of, but I'm sure they also did their job and saved a lot of lives.
And they need to recognize when they might need help afterwards.
Yes, it's important that they, work with their colleagues, that they, make use of resources and community supports as well, to make sure that they're working on their own self-care, because I think first responders, probably are focused a lot on other people, and sometimes they might miss things within themselves. So I think if friends and family are noticing the impact, they can help to support those people who are sort of on the front lines of these kinds of events.
And dozens of people also live there, about 70 is from what I'm hearing. You get to be close living in an assisted living facility, and sometimes people have what they call, survivor remorse. They've lost friends, it could have been them.
It's and that's very common for people who have maybe been involved in this tragedy. They had friends who passed away, or they've had people in the community, and having that guilt that that they survived and other people didn't can be very difficult for people to deal with after an event like this. And so it's really important that they get the support that they need as well. And it affects the community. We know we've had these kind of tragedies, unfortunately, in Rhode Island with the Station nightclub fire. It's been over 20 years, I think, since then. But it has a lasting effect, and it does reverberate throughout the community. And I think when the community can come together and support each other, that's what helps to heal these kind of things in the long term.
When to know when you need help, though? It's not always obvious to the person affected.
Correct. That's why it's important to keep checking in with loved ones over the upcoming days and weeks. It's important to understand that a lot of these initial reactions are normal and they're to be expected. People are going to have a range of emotions. They're going to have sadness. They're going to have anger. They're going to have guilt, as we talked about. And, a lot of those are important that we support and listen and let the loved one take the lead who have been affected by this. And then if it continues on, and if it's affecting their sleep, if it's affecting in the long term, how they're able to function, that's when it's time to start reaching out for help. Initially, you want to create a secure environment, you want to provide support, and you want to have the community rally around and help people to get back to their self-care. And then for the people who might have long-lasting impact from this, making sure that they see a mental health professional, and because there are very effective treatments that are available for people who would need that in the longer term.
And finally, let's talk about the loved ones. They're waiting to find out. There's a fallout from that too. You get so intense, is my loved one okay? Then they're okay, but there can be lasting impacts there as well.
Exactly. So there's a lot of confusion, there's a lot of unknown, and it's important that the family reconnects after something like this, that, in reintegration centers, that people, know that their loved one is safe, be with them, can make sure that they're in a secure environment, and make sure that they can kind of reassure them about sort of what's going to happen next. And that's important for the survivor, but it's also important for the extended family and friends as well. Giving them space, but yet, being there to support them is what's important. And also making sure that you're attending to your own self-care as a loved one, as a family member. I think often the focus is maybe completely on, the victim of something like this. And instead, they also have to pace themselves and pay attention to how it's affecting them, because it might be affecting them more than they understand immediately.
How do you get past this could happen again? They'll probably go into another facility. A loved one might be hesitant. That person might be hesitant because what if?
Exactly right. When worst case scenarios happen, that sort of strikes fear in all of us, because that's what we're always sort of trying to talk ourselves out of. And I think it will take time. There is going to be a period of adjustment. That kind of hesitation or sense of insecurity is going to last for a while. It's important that people acknowledge that they try to seek ways of feeling more assured for the loved one's safety, that they understand that that this moving forward in a new facility is still going to have some tension and anxiety for a while, but that can pass over time as things get back to normal, hopefully.
And I think the bottom line is help is available.
Yes, that's what's really crucial, is that everyone gets the immediate support, but also sometimes the long-term support that they need. And mental health facilities, mental health professionals are so critical, because if people need longer-term treatment, those things are available and are quite helpful. And a lot of people can certainly make a full recovery in terms of getting forward with their life. It'll never be something that doesn't affect them, but we want people to move forward with their life and be able to live their life more fully, even with this as part of their history. And often they need professional help for this if they're struggling.
Okay, thank you so much, Dr. Gaudiano, for your time today and for being with us.
Thank you.